health care more quality much better. Primary care and preventive care, this is really the emphasis for the new health care legislation. It's to focus not on sick care, but rather on keeping patients well. And some of the new models are geared towards doing that. Quality, of course, we have to have a much better model to assure that patients that do have health care are getting the best of care, that they're not being skimped on the visits that they have to have, the preventive types of services. I think the quality of health care is something that will go a long way towards eliminating health disparities. Data collection is important as well. We've got to contain health care costs. It's a runaway train. It will consume us if we don't do something about it. And this is what the law is designed to do, is to help contain health care costs by remodeling delivery systems, as well as by changing payment methodologies under Medicare and Medicaid. How do you pay for it? Well, it's a big ticket, about $938 billion. But if you look at it, there will be a savings of about $124 billion over the 10-year period off of the federal deficit. If we go forward with the plan, the idea is to save some money by reducing payments to plans like managed care plans under Medicare that are really getting very high payments. A lot of it will involve as well some new revenue, Medicare taxes for individuals at $200,000 or $250,000 for couples. There will be an additional tax, and there will be some taxes on the healthcare industry as well, such as particularly drug companies, the health insurance companies, durable medical equipment, will all be parts of some of the newer revenues that are coming in. There's an anticipation that some individuals, the penalties will definitely kick in and provide some revenue. So there will be some savings, and there will, of course, be some new revenues coming in. So just to touch on it briefly again, in 2010, we're doing some things right away that will help get us started, fill in some of the gaps. 2011 to 2013, there will be some demonstration projects to increase payments to primary care and general surgery and health manpower shortage areas. Those are going to kick in next year. There will be a bonus payment for individuals that provide at least 60% of their visits as primary care for doctors. Surgeons who operate in health manpower shortage areas will get a supplemental pay. There will be the big change will take place, of course, in 2014 when Medicaid really expands. The exchanges are fully functional. Premium subsidies are being given so that people can get insurance. The insurance industry is prohibited from doing some of the things that really went against the health care of the nation. The individual mandates will be there, and the employers will be required to give insurance for their employees. So the timeline is good to look at, but to implement it is another story, and it's going to take all of our efforts to make sure that we get it done and that we provide this opportunity not to go backwards but to go forward in delivering good health care particularly to our communities who suffer so much from health care disparities and a lack of access to good health care. So I'm going to stop right there, and I thank you for your attention. I would entertain any questions that you might have. Towards the end? Okay. All right. Thank you.